151. A patient with type 2 diabetes asks about HbA1c goals. What should the nurse explain? Answer: aim for less than 7% for most patients. Rationale: an HbA1c below 7% indicates good long-term glucose control, reducing complication risks, though goals vary by patient. 152. A patient with diabetes has a blood glucose of 700 milligrams per deciliter and is drowsy. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: drowsiness and extreme hyperglycemia suggest HHS, requiring for fluids, insulin, and electrolyte correction. 153. A nurse is inspecting a patient's insulin pump site. What finding requires action? Answer: redness and swelling at the insertion site. Rationale: redness and swelling suggest infection or irritation, which can impair insulin delivery, requiring site change and evaluation. 154. A patient with diabetes reports frequent urination and a blood glucose of 350 milligrams per deciliter. What should the nurse do? Answer: administer insulin as ordered and monitor fluids. Rationale: polyuria and hyperglycemia indicate osmotic diuresis, requiring insulin to lower glucose and fluids to prevent dehydration. 155. A nurse is teaching a patient about diabetic foot hygiene. What should they avoid? Answer: using heating pads on feet. Rationale: heating pads can cause burns, especially with neuropathy, increasing infection risk in diabetic patients. 156. A patient with type 1 diabetes has a blood glucose of 300 milligrams per deciliter before exercise. What should the nurse advise? Answer: test for ketones and avoid exercise if positive. Rationale: glucose above 250 milligrams per deciliter with ketones increases DKA risk during exercise, requiring insulin adjustment first. 157. A nurse is giving insulin to a patient with a blood glucose of 90 milligrams per deciliter. What should the nurse confirm? Answer: the patient will eat soon after. Rationale: insulin at a normal glucose level risks hypoglycemia without food, so meal timing must be confirmed. 158. A patient with diabetes asks about plant-based diets. What should the nurse explain? Answer: they can improve glucose control if balanced. Rationale: plant-based diets reduce insulin resistance, but need adequate protein and nutrients to prevent hypoglycemia or deficiencies. 159. A patient with a blood glucose of 45 milligrams per deciliter is seizing. What should the nurse do first? Answer: administer glucagon or 4-dextrose. Rationale: seizures from severe hypoglycemia require glucagon or 4-dextrose, as oral carbohydrates are unsafe during seizures. 160. A nurse is teaching a patient about insulin syringe disposal. What is the correct method? Answer: place used syringes in a sharps container. Rationale: syringes are biohazardous, requiring safe disposal in a sharps container to prevent injury or contamination. 161. A patient with type 2 diabetes is prescribed empagliflozin. What should the nurse monitor for? Answer: signs of dehydration or urinary infections. Rationale: empagliflozin, an SGLT2 inhibitor, increases glucose excretion, raising risks of dehydration and urinary tract infections. 162. A patient with diabetes has a corn on their foot. What should the nurse advise? Answer: avoid over-the-counter removers and see a podiatrist. Rationale: chemical removers can cause skin breakdown, and corns may hide ulcers, requiring professional care in diabetes. 163. A nurse is caring for a patient with DKA. What indicates treatment effectiveness? Answer: rising pH and falling glucose levels. Rationale: effective DKA treatment corrects acidosis, increases pH, and lowers glucose, indicating metabolic stabilization. 164. A patient with diabetes asks about yoga. How does it benefit them? Answer: it reduces stress and improves glucose control. Rationale: yoga lowers cortisol, which can raise glucose, aiding in better diabetes management alongside physical benefits. 165. A nurse is teaching a patient about sick day rules. What should they do if vomiting? Answer: sip small amounts of carbohydrate fluids and test glucose. Rationale: small sips maintain glucose and hydration, while frequent testing prevents DKA or hypoglycemia during illness. 166. A patient with type 1 diabetes reports increased hunger and fatigue. What should the nurse assess? Answer: blood glucose for hyperglycemia. Rationale: polyphagia and fatigue suggest uncontrolled hyperglycemia, requiring glucose testing to guide treatment. 167. A nurse is preparing to administer insulin glargine. What is its duration of action? Answer: up to 24 hours. Rationale: glargine is a long-acting insulin providing basal coverage for 24 hours, typically given once daily. 168. A patient with diabetes has a blood glucose of 80 milligrams per deciliter at bedtime. What should the nurse suggest? Answer: eat a snack with protein and carbohydrates. Rationale: a balanced snack prevents nocturnal hypoglycemia, especially with near-normal glucose levels. 169. A nurse is teaching a patient about CGM alarms. What should they do if it signals low glucose? Answer: check fingerstick glucose and treat if confirmed. Rationale: CGM alarms may be inaccurate, so confirming with a fingerstick ensures appropriate treatment for hypoglycemia. 170. A patient with a diabetic foot ulcer has swelling and odor. What should the nurse do? Answer: notify the provider and prepare for wound culture. Rationale: swelling and odor suggest infection, requiring urgent evaluation and culture to guide antibiotic therapy. 171. A nurse is drawing up regular and NPH insulin. What should be drawn first? Answer: regular insulin. Rationale: drawing clear regular insulin before cloudy NPH prevents contamination of the regular insulin vial, ensuring accuracy. 172. A patient with diabetes asks about preventing blindness. What should the nurse recommend? Answer: tight glucose control and regular eye exams. Rationale: good glucose control slows retinopathy, and exams detect early changes, preventing vision loss. 173. A patient with type 2 diabetes reports joint pain. What should the nurse assess? Answer: medication side effects or neuropathy. Rationale: joint pain may stem from diabetes complications like neuropathy or medications, e.g., DPP for inhibitors, requiring evaluation. 174. A nurse is teaching a patient about glucagon storage. Where should it be kept? Answer: at room temperature, away from heat. Rationale: glucagon remains stable at room temperature but degrades with heat, ensuring it's effective for emergencies. 175. A patient with diabetes has a blood glucose of 160 milligrams per deciliter before dinner. What should the nurse do? Answer: administer insulin as prescribed. Rationale: a premeal glucose of 160 milligrams per deciliter is elevated, requiring prescribed bolus insulin to control postprandial levels. 176. A nurse is teaching a patient about diabetic neuropathy. What reduces its progression? Answer: maintain tight glucose control. Rationale: chronic hyperglycemia damages nerves, so tight control slows neuropathy progression and symptom worsening. 177. A patient with type 1 diabetes has nausea and a blood glucose of 380 milligrams per deciliter. What should the nurse do? Answer: test for ketones and notify the provider. Rationale: nausea and hyperglycemia suggest possible DKA, requiring ketone testing and urgent medical evaluation. 178. A nurse is teaching a patient about insulin injection sites. Why rotate sites? Answer: to prevent lipohypertrophy. Rationale: repeated injections in one area cause fat buildup, lipohypertrophy, impairing insulin absorption and glucose control. 179. A patient with diabetes reports foot tingling. What should the nurse suspect? Answer: peripheral neuropathy. Rationale: tingling is a hallmark of diabetic neuropathy caused by nerve damage from hyperglycemia, requiring further assessment. 180. A patient with hypoglycemia is now stable after treatment. What should the nurse provide? Answer: a balanced snack with protein and carbohydrates. Rationale: a snack stabilizes glucose after hypoglycemia, preventing recurrence until the next scheduled meal. 181. A patient with type 2 diabetes is prescribed dulaglutide. What is a common side effect? Answer: nausea or vomiting. Rationale: dulaglutide, a GLP-1 agonist, often causes gastrointestinal upset initially, which typically improves over time. 182. A nurse is teaching a patient about meal timing with insulin. Why is it important? Answer: to prevent hypoglycemia or hyperglycemia. Rationale: timing meals with insulin ensures glucose availability matches insulin action, balancing blood glucose levels. 183. A patient with diabetes has a blood glucose of 800 milligrams per deciliter and is lethargic. What should the nurse prepare for? Answer: treatment for hyperglycemic hyperosmolar state, HHS. Rationale: lethargy and extreme hyperglycemia indicate HHS, requiring urgent fluids, insulin, and electrolyte management. 184. A nurse observes a patient reusing insulin needles. What should the nurse teach? Answer: use a new needle for each injection. Rationale: reusing needles increases infection risk and dulls the needle, causing pain and inconsistent insulin delivery. 185. A patient with diabetes asks about exercise timing. When is it safest? Answer: after meals when glucose is stable. Rationale: post-meal exercise uses available glucose, reducing hypoglycemia risk compared to fasting exercise. 186. A nurse is caring for a patient with DKA. What potassium issue should be monitored? Answer: hypokalemia during treatment. Rationale: insulin and fluids shift potassium into cells, causing hypokalemia, which can lead to arrhythmias if unmonitored. 187. A patient with type 1 diabetes missed their evening insulin. What should the nurse assess? Answer: signs of hyperglycemia or DKA. Rationale: missing insulin causes glucose and ketone buildup, potentially leading to DKA, requiring symptom and lab assessment. 188. A nurse is teaching a patient about preventing hypoglycemia. What is a key habit? Answer: carry a fast-acting carbohydrate source. Rationale: having glucose tablets or juice available allows rapid treatment of hypoglycemia, preventing severe episodes. 189. A patient with diabetes has cracked heels. What should the nurse advise? Answer: moisturize daily and avoid open-toed shoes. Rationale: moisturizing prevents skin breakdown, and closed shoes protect cracked heels from infection in diabetic patients. 190. A nurse is reviewing a patient's glucose log with high morning readings. What might this indicate? Answer: dawn phenomenon or inadequate basal insulin. Rationale: morning hyperglycemia may reflect hormonal glucose surges, dawn phenomenon, or insufficient overnight insulin, needing adjustment. 191. A patient with type 1 diabetes has a blood glucose of 520 milligrams per deciliter and reports nausea. What should the nurse prioritize? Answer: check for ketones and notify the provider. Rationale: nausea and severe hyperglycemia suggest diabetic ketoacidosis, DKA, requiring ketone testing and urgent medical intervention. 192. A nurse is teaching a patient about insulin aspart timing. When is it most effective? Answer: just before or after meals. Rationale: aspart, a rapid-acting insulin, has a 10-20-minute onset, aligning with meal-related glucose spikes for optimal control. 193. A patient with type 2 diabetes has a blood glucose of 60 milligrams per deciliter and feels dizzy. What should the nurse do first? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: mild hypoglycemia requires 15 grams of fast-acting carbohydrates, e.g., juice, to raise glucose, with rechecking after 15 minutes. 194. A patient with diabetic neuropathy finds a blister on their toe. What should the nurse advise? Answer: keep it clean and consult a provider. Rationale: neuropathy impairs healing, and blisters can lead to infection. Prompt cleaning and medical evaluation prevent complications. 195. A nurse is preparing to administer insulin glargine and lispro. How should they be given? Answer: in separate syringes. Rationale: glargine's unique pH makes it incompatible with lispro. Mixing alters their action, compromising glucose control. 196. A patient with diabetes reports thirst and a blood glucose of 400 milligrams per deciliter. What should the nurse suspect? Answer: hyperglycemia. Rationale: thirst, polydipsia, is a classic hyperglycemia symptom caused by dehydration from osmotic diuresis, requiring treatment. 197. A patient with type 2 diabetes on metformin has a procedure with contrast dye. What should the nurse do? Answer: hold metformin for 48 hours post-procedure. Rationale: contrast dye can impair renal function, increasing metformin-related lactic acidosis risk, so it's held temporarily. 198. A patient with diabetes has a blood glucose of 50 milligrams per deciliter and is alert. What is the nurse's priority? Answer: administer 15 grams of fast-acting carbohydrates. Rationale: hypoglycemia in an alert patient requires 15 grams of carbohydrates to raise glucose safely, followed by monitoring. 199. A patient with a diabetic foot ulcer reports increased pain and redness. What should the nurse do? Answer: notify the provider and assess for infection. Rationale: pain and redness suggest infection, which can escalate quickly in diabetic patients, requiring urgent evaluation. 200. A nurse is teaching a patient about insulin vial storage. How long can open vials be used? Answer: up to 28 days at room temperature. Rationale: opened insulin remains stable for 28 days at room temperature, ensuring potency if protected from extreme heat or cold.